Diagnosis of COVID-19. Hello and welcome to this module on the differential diagnosis and diagnosis of COVID-19. Now let's learn in detail about diagnosis of COVID-19. The prime suspects for COVID-19 include patients with fever and lower respiratory tract symptoms. Geographical distribution is also an important aspect of diagnosis. The geographical distribution and recent contact with the suspected patients should also be taken into consideration. Finally, if suspected with COVID-19, infection control measures should be implemented and public health officials should be notified. Let's understand the diagnostic criteria for COVID-19. According to the CDC, diagnosis should be based on clinical and epidemiological factors. The clinical criteria for confirming the diagnosis of the severity of coronavirus is broadly categorized into 4 types: mild, moderate, severe, and critical. For the mild type, the symptoms include fever less than 38 degrees centigrade. In case of moderate type, the patient may be presented with fever, respiratory symptoms, and imaging findings of pneumonia. If the patient is affected severely with COVID-19, then any of the below-mentioned findings can be observed. 1. Respiratory distress. 2. Oxygen saturation of less than 93% at rest. 3. Partial pressure of oxygen and fraction of inspired oxygen less than or equal to 300 millimeters of mercury. Patient with a rapid progression that is greater than 50% on CT imaging within 24 to 48 hours should be managed as severe. In case of critical condition, the findings can be respiratory failure, shock, and extrapulmonary organ failure. Intensive care unit is necessary. We have discussed diagnostic criteria to be followed for COVID-19. Let us now learn about the investigation methods. Respiratory material from upper and lower respiratory tract must be collected. The upper respiratory tract specimen includes nasopharyngeal or oropharyngeal swab or wash in ambulatory patients. Lower respiratory tract specimens include sputum and/or endotracheal aspirate. Other methods of collection include blood and stool. The specimens are to be collected in sterile containers and must be stored at 2 to 8 degrees centigrade. In case of delay, the specimens are frozen at -20 degrees centigrade and then shipped. We have learned about the diagnosis, diagnostic criteria, and the investigating methods for patients. Let's now look at the various laboratory investigations. Nucleic acid amplification tests, or NAAT tests, by real-time reverse transcription polymerase chain reaction, or RT-PCR, for COVID-19 to check for evidence of viral load indicating active infection. Serological testing for detecting antibodies, viral sequencing, and viral culture. Rapid collection of the specimen and testing of specimens from patients meeting the suspect case definition for COVID-19 is a priority for clinical management and outbreak control and should be guided by a laboratory expert. Now that you have reached the end of this module, let's recap the important points. The prime suspects for COVID-19 include patients with fever and lower respiratory tract symptoms. Once suspected for COVID-19, infection control measures, along with notification to the public health officials, should be implemented.